You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV, and I'm your host, John Tassoni. My guest today is Miss Lisa Conlon-Lewis, and she is the Executive Director of the Parent Support Network of Rhode Island. Lisa, welcome, and thank you for joining us today. Can you tell my viewers what the Parent Support Network is all about?
Definitely. So Parent Support Network, we are a family and peer-run statewide nonprofit. We really, everybody that is in our organization has some level of behavioral health experience, which is either their own lived experience in recovery with substance use, mental health, or co-occurring mental health, substance use, and or their parents, family members raising children with high-end behavioral health needs. So we are the families, we are the peers, and we've actually become pretty sophisticated in our work, and we do service delivery across the lifespan from a non-clinical peer role, and we also are big around building family, youth, peer leadership to promote positive change within systems and service delivery, policy, and practice.
So with the pandemic and the opioid crisis that Rhode Island's been in over the past two and a half years, I'm seeing a big change with children, parents, and it's almost like a perfect storm at this particular point. So an organization like what you run is very much needed. Can you tell my viewers about when you started 2.5 years ago till today, the amount of increase in clientele that you may have had at your facility?
Right. Well, I think one of the things that's important is we don't have a formal enrollment process. We're very open-ended statewide helpline and support. So we've seen that people sort of being lost, not sure where to turn.
Where to go?
They're not sure where to go to get that support. They need somebody to just talk it through. You know, it may not be a formal diagnosis at this point of mental health, and they're sort of mistrusting on where to turn, or they haven't gotten good direction. So I think we're really seeing an increase, but then at the same time, we're not seeing people connect to those services to the level that they should be. So, we're doing a lot of referral, but a lot of warm transfers. If we just give people the phone numbers, it doesn't seem they make the connection.
Right.
We really have to do a lot of the warm transfers, so we're actually helping them get there if we even have to transport.
Now, your organization, does it mostly do adolescents? Does it do just family as a whole, or moms and dads?
All of the above.
All of the above.
Yeah.
Okay.
So even starting at that really young, and we cut across the lifespan. So a lot of times you see child and family services over here doing a lot around the child and family, and then you have adult world where it's behavioral health. We really cross those two over together. So a few examples of that is, so we have a pregnant women and parenting program where we are actually offering to pregnant women who have perinatal substance exposure, which could create a lot of stigma, not quite sure to where to turn, how to get that help.
Before we go any further, what is that? What is it?
Perinatal substance exposure is a pregnant woman actually using substances as opiates that can start to have an impact on an unborn child's fetus.
Yeah, okay.
So again, women that are going through that experience, sometimes they're really afraid to tell anybody around their use. They need help getting onto medication-assisted treatment, even educating some of the OBGYNs about the role of that and that it's not.
Yeah.
Sometimes people are told not to do that or to go off their medications and such.
Now, is there a stigma to that too?
Definitely.
Okay.
Definitely. And it's about finding, again, the right resources and support. So we have wonderful relationships with the consultation at Women and Infants Hospital and the clinics there and getting everybody connected,
Right.
bringing them right to an agency where they can get that one-stop shop of maybe a good assessment, able to get screens, because in most cases, these are women that are going to be high risk of becoming involved with child welfare and DCYF.
Right.
So we have a lot of those relationships, or then, we're helping them prepare for the birth, helping them get all the right treatment services in place. So by the time they give birth, they have a checklist that they've done all the right things so that the baby is not removed and that they're getting the right treatment modality. So that brings us to early childhood, right? So we're working with parents that are very high risk, child welfare involved, helping them to get those services. We specialize in parents who themselves have mental health challenges, opioid addiction, or substance use. So that's sort of how we brought the worlds together, John. And where sometimes
certainly
you don't
did.
see that. You don't see that every
Certainly
day.
did, yeah. And I look at the overall aspect of these women who are pregnant with issues of babies being born, and those babies have if they don't get the right help, those babies could be on support or be in the hospital for long periods of
Most
time,
definitely.
and then they come out with a lot of issues pertaining to them growing up.
Most definitely, which gets into, the high risk of
Right.
all those types of traumas that can occur in that. And most people around the state don't even know that, it's the whole 5th floor of Women and Infants Hospital who's dedicated to what a baby that is born with neonatal abstinence syndrome. So with NAS, that is another big thing that we're working with the families and supporting them and helping to make sure that they're getting the right supports and connected to the right services.
And there's a lot of folks out there that don't even realize what your organization
No,
does.
and we have a whole team that
Right.
focuses just on
Right.
that. And then we get referrals that come from DCYF investigators. So a few years ago, you wouldn't, you would see that in a family and right away the children would be pulled.
Right.
Now we're understanding the role of attachment in substance use or behavioral health with a child. And so we're trying to get in there early and put the right supports around the family. So our peer recovery specialists specialize in that. And now we've watched at least 200 families in the last year and a half not open formally to DCYF.
Wow.
So they get the right supports in place and they get, and that's our goal, to really wrap around the children and the families. And again, in our old days when we were first starting as PSN, which we still do really strong, we're helping the child and the adolescents and do the best that they can to
Right.
thrive with their mental health conditions and such. But now, in our years of experience, and especially working with child welfare and the justice systems and that, we are working now directly that we have to have that parent stable and help that parent get really strong. And so that's where we bring those both worlds together. So we have parent partners who focus a lot on the children and their relationship to the family, and then we have peer recovery specialists who are focused more on the stability of the parent and their mental health or
I
substance
definitely
use.
want to talk more about that when we come back. We got to take a break. You've been watching Recovery TV, and I'm your host, John Tassoni, here with Lisa Conlon Lewis, and she is with the Parent Support Network of Rhode Island, and we'll be right back after this.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. By quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you. Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
The Rhode Island Department of Health reports that drug overdose death is the #1 cause of accidental death in our state. Zinnia Exeter is committed to helping overcome addiction and the silent epidemic of drug overdose. Our substance abuse completion rates are over 25% higher than the national average. If you or a loved one is struggling with addiction, call Zinnia Exeter to learn about treatment options.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Lisa Conlon-Lewis is here today, and she's the Executive Director of the Parent Support Network of Rhode Island. Lisa, welcome and thank you for the work that you do.
Thank you.
Listening to you in the last segment pertaining to the pregnant women and what you do for those folks is really something. And if we can, again, as you indicated, if we can just wrap our arms around these folks and get them in a right place to stop using or help them through the process, all Rhode Island will be better off. You know, when I came into this industry 5 years ago, it was 1 in 5 families that were affected by substance use and mental health, and now we're down to 1 in 2 families. It's very heart-wrenching when you see what's really out there, when your boot's on the ground. You know, one of the things, too, that the state is trying to start up that's been getting a lot of flack, but I think if we do it and do it right, I think we'll be better off, is harm reduction. Tell me about your thoughts on that.
Most definitely. So at Parent Support Network, we have what's called our core statewide outreach team. And so we work with Department of Health through a CDC grant where they do a surveillance every week where the greatest opioid use is. So we have opioid hotspots across the state. And our team helps to respond to that. They go, they work really close with Weber, Renew, Anchor in the urban areas, but we take on the whole rest of the state. And so as we're doing that work, and what people don't really understand too is when you get more to the rural communities or the outer urban, 1 in 4 opioid overdose. So some people don't understand that because the urban gets a lot of the attention. But harm reduction is so important because we have to meet people where they are at. And every day, especially because we've seen such an increase in overdose with the opioid, with both the pandemic and the epidemic, being able to meet people where they're at, save their life, help to understand not only, their challenges where they are with use, but also to try to prevent more disease to occur, such as HIV or hepatitis and that. So you're really trying to instill whatever you can to get them to safer use, to help understand that. We've seen, especially in our African American community, on Good Morning America yesterday, they were talking about smoking kits. Well, they don't understand when they put back that fear around that we've seen a huge increase in our African Americans as it relates. And again, they weren't using intravenous syringes, they were smoking, and again, crack has fentanyl. So again, we're educating and teaching. Yes, they may need the kit for not the right reason,
Right,
some of it,
right.
but we have everything that's combined in that kit for all the right reasons, which allows us to make engagement. So harm reduction activities and supplies that allow us to make that engagement is hopefully going to help us refer them and connect them to the services and the treatment that they need. So I believe having whatever ways and means that we can, and even a center where people could use and get that connection, is not going to increase the challenge. It's going to help and support.
Yeah, we have to do things different. We can't be the old way. It's got to be innovative, thinking outside the box to get people to quit. I'll use that word, to get them into treatment, to get them to be productive citizens again, and especially pregnant moms.
Yes.
You know, because if you don't get that rectified, these children are going to be have issues growing up and going through school, and God knows after they get out of school what's going to transpire from them. But you know, your organization does a great job, and you're also one of the sponsors of the show, so thank you for that. But I think as we go down this road, it's a very slippery slope we're at right now. We're at a point where the system as a whole, we have a crack in the foundation. And that's not good. You know, the rates need to be upgraded so you can keep qualified staff, so you can run your organization. You can't run your organization on what you were getting in 2000 compared to 2022. There's got to be some sort of increase in there. Staffing is an issue, I know. Qualified staffing is an issue. Why would you want to go to work for Parent Support Network where you can go to McDonald's and get $4 an hour more? Are you having trouble keeping staff? Are you having trouble hiring staff?
I would say we're having trouble in keeping the morale and the ability for the staff to continue to do what they do in a really healthy way.
Right.
You know, we have become a trauma-informed organization at all levels, so it's not even trauma-informed, and which is a consistent thing we do to help the people out there, but now we're practicing trauma-informed in the
your own place.
organization.
Right.
Because every day it's a challenge. So we have seen a huge increase in medical leave.
Really?
Parent, you know, because again, remember, we're a peer workforce, so everybody's coming with a level of past experience with mental health or substance use, so we're seeing them more at risk. It doesn't help if they're not getting paid well, if they're seeing challenges, if they're having challenges within their own access to treatment, not just even for themselves, but their own children. So those things that we see in the people we serve every day, we see a mirror of that within our own organization.
What have you seen as far as expedited, I'll use the word expedited treatment? Is it more on the family end or is it more on the individual end? We only got a few minutes because then we have to go to break, and then we'll continue.
I would say it's more on the individual end.
Okay. Yeah, because, you know, we see it, we get the phone calls here, obviously, and we refer out, but, you know, that's one of the things that we need to talk about when we come back. You've been watching Recovery TV, and I'm your host, John Tassoni. We're here today with the Executive Director of the Parent Support Network of Rhode Island, Miss Lisa Conlon-Lewis, and we'll be right back after this.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You know, you can make it through this, you can get back on track.
I started getting in trouble when I was really young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
Addiction Recovery Institute with locations in Pawtucket and Warwick have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
With these,
and this,
with my mouth shut,
and my ears wide open.
It means that from the moment you walk into the room,
you're the most important patient to me.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. We're here with Lisa Connell-Lewis, and she is the Executive Director of the Parent Support Network of Rhode Island. So, Lisa, thank you very much for joining us today, and thank you for being a sponsor of the show. You know, I want to continue our conversation from the last break pertaining to families and what you're seeing, individuals. And we get a lot of calls here that we refer out to for different areas of substance use and mental health. And we, meaning the organization here, sometimes are confused, meaning that it's not only the individual that's having the problem, but they don't tell us that. It's the family that's having the problem. Are you seeing an uptick in that?
Most definitely, most definitely. And sometimes one family member is impacting the other family member.
Right.
So usually when you get in, somebody might call for one person, but then
Once
you
you get in
connect,
there, yeah.
you start to learn. So like dad had a substance use, but the son stole his substances.
Yeah.
DCYF got called. Next thing we're in there learning and we're helping both the
helping
parent
everybody.
and the child.
Yeah. So I would like you to give out your phone number and your website for the people who are watching, because your organization is truly an asset in the state of Rhode Island because of what's happening right now. So go ahead.
Definitely. 401-467-6855. And that's our main line that will get you to any of our locations and that. And our website is psnri.org.
Well, thank you for that. And I want you to go back and tell your staff I really appreciate what they do on a day-to-day basis, because it's not easy. It's not easy. And a lot of them, as you indicated, have come up through the ranks, that have gone through everything that now that you're helping try to eradicate the problems that the Rhode Islanders are having. So thank you very much. Thank you to your staff. Thank you for being a sponsor. It's truly an honor and a pleasure to have you on for the work that you do. Ms. Lisa Connell-Lewis, the Parent Support Network here in Rhode Island. If you need her, call her or email her or get on the website, because she is a voice of hope. Thank you for watching today. This has been Recovery TV. I'm your host, John Tassoni. We'll see you next week.
You've heard me telling you about how the folks at Lapco are my personable particular professionals. Don't let your home repair or painting project go downhill this year. Call Lapco at 1-800-PAINTING and have the conversation now. Interior or exterior painting, small or large repairs, or a home renovation, Lapco Contracting does it all, whether you live at the top of the hill, the bottom, or anywhere in between. Call Lapco now at 1-800-PAINTING or log on to lapcocontracting.com. Salute.
When people find out that I've been sober for a while, they say, oh, you must have great willpower. The truth is I have no willpower. And that's why I decided to get help. You know, it must take a lot of strength to stay sober. No, it takes strength to ask for help. And once you're done, once you've decided that you don't want to live like this anymore, the real strength and the real courage comes when you ask for help. And then you'll find that people are willing to give that help. And that's when your life can really begin.
Sometimes everyone can use a helping hand. At TriCounty Community Action Agency, we offer support services when you need it the most. From food and heating assistance to family health and dental care, we have programs to lend a helping hand throughout the whole life cycle. From grandkids to grandmas, individuals or families. If you or someone you know could use a helping hand, visit our website at tricountry.org to learn more about the many services we provide. We know it isn't easy to ask for help. At TriCounty, we are here when you need us. For more information, visit tricountry.org or call 401-351-2750.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build a life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
Anchor Recovery has been a mainstay since 2010 and was the first recovery community center in the state. Anchor Recovery has grown from just a couple of 12-step meetings to an entire cadre of meetings supporting multiple pathways of recovery. Today, we support medicated assisted treatment, mindfulness, meditation, yoga, and physical aspects of recovery. Easy access in 3 locations. Learn about how recovery can help you. Different paths, same destination. Stop in, call, or visit anchorrecovery.providencecenter.org.
Tune in every weekend for a new edition of Recovery TV. Host John J. Tassoni Jr. discusses information on addiction and mental health issues with local leaders in today's recovery world. Tune in Saturday evenings on MyRI TV or Sunday mornings on CW Providence or Fox Providence.